Hi everyone, and welcome to Module 5. So this week we are focusing on the topics of the urinary and reproductive systems, and that's the reproductive systems for both male and female patients. So we are going to be looking at chapters 11, 12, and 13. So let's go ahead and get started here. So for this first chapter, chapter 11, we're focused on the urinary system. And the urinary system does consist of 2 kidneys, 2 ureters, a urinary bladder, and the urethra. And the primary function of the urinary system is to regulate what we call the extracellular fluids of your body, which is done through the formation of urine. The kidneys, however, carry out the major work of the urinary system. The urine passes out of the kidneys through the ureters into the bladder and gets stored there until it is excreted from the body through the urethra. So let's go ahead and take a look and break down that urinary system a little bit more. And we break this down into what we call macroscopic and microscopic structures. So let's go ahead and talk about each of those. We're going to start with macroscopic structures. Macroscopic means that they are large enough for us to see without the use of a microscope. The first thing that we have as a macroscopic structure is your kidneys. And your kidneys are about the size of your fist, and they are in the shape of a bean, which is where we kind of come up with the term kidney bean. They're located in the retroperitoneal part of the body, which is the back lower part of the body. The next macroscopic structure is our ureters. Again, there are 2 ureters that are about 10 to 12 inches in length. They come each side of the kidney. Each one comes from one of the kidneys, so one tube. They're very, very thin. They're a little bit thicker than like pencil lead, so very thin. And their whole job is just to carry urine from the kidneys down to the bladder. Which then leads us into our next macroscopic structure, which is your urinary bladder. This is a hollow organ found in the anterior abdominal cavity, so the lower part of your abdominal front, and its whole job is to hold urine until it gets expelled from the body. And how it gets expelled from the body is the urethra, which is also a macroscopic structure. The urethra is what will go from the bladder to the urinary meatus, which is the opening of the body, and it is different sizes for both male and female patients. The male's is going to be anywhere from 4 to 7 inches in length, and women's is only going to be about 1 to 2 inches in length. So these are all your macroscopic structures. We also have microscopic structures, and the microscopic structure is going to be the nephron. So this is a very blown up version of what your nephron looks like. And microscopic means that we cannot see these with our naked eye and we need a microscope to view them. When it comes to the urinary system, again, that microscopic structure is your kidney. There are approximately 1 million million nephrons in each kidney, and the nephron is what we call the functional unit of the kidney. And it is responsible for maintaining homeostasis by continually adjusting and regulating the contents of our blood plasma. The kidney and the nephron specifically, has 3 functions and 3 important roles. The first one is filtration. So what this means is it's going to filter our blood to remove any waste products. What doesn't get filtered is going to then be reabsorbed, and that reabsorption is going to put that water back into our blood system, and it puts back some of the electrolytes and amino acids. After it is reabsorbed, it then gets secreted, and that is the final stage where we actually create the urine to leave our body. Here are some of the word parts that you will hear that relate to the urinary system. In addition, this chapter does go on to discuss the pathology of the urinary system, And it includes discussions on things like paleonephritis, which is a kidney stone, glomerular or glomerulonephritis, nephrolysis, acute tubular necrosis, along with different medications that are used to treat the diseases just listed here, as well as any others that are used for the urinary system. So I highly recommend going in and reading those. I also highly recommend going in and doing the end of the chapter activities to really help with your knowledge and learning basis. Moving on to chapter 12 is going to talk about the female reproductive system. And the female reproductive system is designed to produce and transport the ova, which is the female sex organ. And it also deals with discharge from the ova of the body if fertilization does not occur. It helps to nourish and provide a place for developing fetus through pregnancy and fertilization. The female reproductive system also produces female sex hormones, which we call estrogen and progesterone. And they play an important role in our reproductive process. These hormones are responsible for the development of secondary sex characteristics such as our breasts, as well as the regulation of our menstrual cycles. Now, the female reproductive system does have both internal and external organs. These internal organs are things like your ovaries, fallopian tubes, and uterus, as well as the vagina. The ovaries are almond-shaped glands located on each side of the uterus, and each ovary contains 1,000 ovum or eggs. And females are actually born with all of the eggs that they will ever have in their life. We do not reproduce them like men do. Fallopian tubes are next, and these extend from the uterus and they surround the ovary, but they actually do not connect to the ovary. They will help to move the ovum or egg from the ovary to the uterus to be fertilized. The uterus is next, and this is a muscular, hollow, inverted pear-shaped structure that is located in the pelvic area between your bladder and your rectum. The uterus consists of 3 parts: the fundus, which is what we call the top part, the body, which is the middle or the central part, and the cervix, which is the lower part. And from the cervix, we have the vagina. And again, that is a muscular tube that extends from your cervix into the exterior of your body. The exterior organs are going to be the labia minora, labia majora, clitoris, and mons pubis. But along with those, we have things like your breasts. Those are also considered external organs. The breasts are found within the breasts are found and composed of mammary glands, and they are found in both male and female patients, but they only have a function in the female reproductive system. The breasts are not directly related to the reproductive system, but they become important after a baby is born and after delivery. Their role is to secrete milk for nourishment for the newborn through a process we call lactation. The menstrual cycle consists of a series of phases during which the uterine endometrium changes as it responds to changing levels of hormones. The typical duration of a menstrual cycle is 28 to 35 days. The term that we use for the initial menstruation period is called a menarche, and this typically happens around puberty for females, which is going to be around age 12. Now that can change for every patient and every female body. Every body is going to be different. The female reproductive system also deals with pregnancy. Now, during pregnancy, the uterus will change its shape, size, and consistency. And the average pregnancy or gestation is approximately 9 months, broken into 3 trimesters. Each trimester is 3 months at length. And up to the 3rd month of pregnancy, there's a product of conception. It's called an embryo. After the 3rd month, it is from the time of birth, the unborn child is then called a fetus. After the fetus has reached its 9 months of gestation, we have to go through labor and childbirth, or labor and delivery. The labor process by which the fetus is expelled from the uterus happens in 3 stages. Stage 1 is dilation. This is the beginning of the uterine contractions, and it terminates when they have reached 10 centimeters in duration. The second stage is called expulsion. This is the time from the complete cervical dilation to the birth of the baby. And then that final stage is called the placenta stage. And I apologize, that is in a funny spot. The placenta stage is shortly after childbirth, when the uterine contracts to discharge the placenta from the uterus, as it is no longer needed. Now it's in the third spot. Sorry about that, guys. All right. After a woman has reached a point where she is no longer having menstrual cycles, she reaches what we call menopause. So this is when the sensation of ovarian activity and the hormone production stop. This will typically happen when the female reaches approximately age 50, but again, that can be different for every patient. Menopause is usually diagnosed with amenorrhea, which is the absence of a menses for at least 1 year. Menopause usually comes with symptoms of hot flashes and vaginal dryness, as well as vaginal thinning. This is all due to the fact that they are losing that estrogen level of hormone. All right, here are some female word parts that you will hear. I'm going to let you have a moment to view these on the screen, as there are 3 slides of these. You can also pause the video to take any notes on these. Slide number 2. Now this chapter again does go on to discuss pathology associated with the female reproductive system. This includes the topic of gynecology and obstetrics, menstrual disorders, endometriosis, PID, which is pelvic inflammatory disease, vaginal infections, and vaginitis. This chapter will also discuss things like breast and cervical cancer, as well as some medical, surgical, and diagnostic procedures. Again, I would highly recommend reading your chapter, as well as doing the end of the chapter activities to help with your knowledge base. To wrap up our units this week, we have chapter 13, which is talking about the male reproductive system. The male reproductive system produces, maintains, and transports sperm, which is the male sex cell required for fertilization. It is also important for the development of male secondary sex characteristics, which we'll go into talking about in just a minute. The primary reproductive organ of the male reproductive system is the 2 testes and the external sac that we call the scrotum. The testes produce the hormone testosterone, which enables the development of secondary sex characteristics. It also helps to play a role in the libido of males. Within the testes are numerous tubes called the seminiferous tubules that produce sperm. Sperm is the male gamete or sex organ that is used for fertilization of the ovum in females. The interesting thing about the sperm and the male reproductive system is they can continually remake or make new sperm until they pass away. And by pass away, I mean the patient themselves. So they can make sperm throughout their entire lifetime, where females, their ovum are all that they're born with. So we're born with as many eggs for females as that we will ever have in our life, but males can reproduce all the time. The epididymis lies over the superior surface of each testis and will store the sperm after it leaves the seminiferous tubules. This is the first duct that sperm will pass through after it is produced. And if you were to trace that duct upward from the epididymis, it would form the vas deferens. And this is a narrow tube that passes through the inguinal canal into the abdominal cavity. The vas deferens extends over the top and down the posterior surface of the bladder for males and joins the seminal vesicle. The union forms the ejaculation duct, and from there the ejaculation duct passes at an angle through the prostate gland. The prostate gland is a triple-lobed organ fused to the base of the bladder. It secretes a thin alkaline substance that accounts for 30% of seminal fluid. Alkaline means that it is very basic. Before we talked about pH, remember we had alkalinity and acidity, so alkaline means base. Now this fluid that it creates will help to protect the sperm from any acidic environments of the male urethra and female vagina. The urethra will expel the semen from the body during ejaculation, but because it also expels urine from the body during ejaculation, the sphincter at the base of the bladder will close, so that way when ejaculation does happen, it's not urine and semen, it's just semen. And the same kind of thing when a male urinates, it doesn't have semen in the urine as well. All right, here are some male reproductive terms for you. Again, you can pause the screen to take any notes, but these are also on your study guide for the week. Again, this chapter will go into discussing the pathology related to the male reproductive system, and this does include things like STIs or sexually transmitted infections, BPH, which is benign prostate hyperplasia, cryptochondrosis, prostate cancer, testicular cancer, as well as other diseases and conditions. All right, and to wrap up this video, what I want to do is talk about your homework for the week. So first thing that we do have is your discussion board. It is the last discussion board for this course, so please make sure that you complete your initial posting by Tuesday, January 31st at midnight. Please make sure that you are following and answering all of the questions or topics that are in the topic posting to get full credit for your initial posting. You will need to reply to at least one, but preferably 2 classmates by Saturday, February 4th. After that time of midnight on February 4th, the discussion board does close, so you will not be allowed to go back in and do any reply postings. You have your dictation assignment for this week that is going to be due on Sunday, February 5th. You have your last course project, I believe. Nope, I lied. There's one more in week 6. Your course project this week is on treatment notes. That's also going to be due Sunday the 5th. You'll have your quiz, which remember you only have 1 attempt at, and it is timed. Again, due Sunday, February 5th. And your live classroom assignment. And the live classroom is taking place on January 31st, which is Tuesday at 11 a.m. If you are unable to watch that, please make sure that you do watch the recording, which you can find in your Teams folder. And please make sure you're paying attention during the live lecture to actually catch the code word. All right, guys, that is what I have for you. I hope that you all have a great week 5. It's your last full week with me. And we'll see. If you have any questions, please reach out to me. Otherwise, I'll see you at your live lecture. Bye, guys.